All right, we'll go ahead and get started. Thank you all for being here. Today, we will have updates on COVID-19, RSV, and flu. Our speaker will be District Health Officer Kevin Dick. Kevin, if you're ready to go, please start us off.
Yes, thank you, Scott. Thanks, everybody, for being here today. I want to begin with RSV. Happy to report that last week's total RSV cases was the second lowest that we've had this season. We had just 10 cases that were reported last week. So that's the lowest going back to the first week of our reporting last October, where we had just 8 cases. But for the season, we've eclipsed 2,000 cases, and we're currently at 2,009 cases so far. The season is going to run through the first 20 weeks of this year, so we have a ways to go yet. As a reminder, on a typical year, we have about 750 total cases of RSV. So we're getting to almost 3 times that number. Moving on to COVID-19, we saw a decrease in COVID-19 infections in the last 2 weeks. Our 7-day moving average of new cases is at 29.14 per day. Last time that we did the media brief a couple of weeks ago, that number was almost 40, 39.9. So we're seeing a decrease in COVID cases that are reported. As far as the variants that are being detected by the Nevada State Public Health Lab in their genomic sequencing, the XBB variants have overtaken the BQ variants as the predominant variant detected in Washoe County. 2 weeks ago, when we reported XBB1 and XBB 1.5 variants accounted for about 27% of all of the sequenced variants. And this week it's at about 48%. So the XBB has been climbing, and the XBB 1.5 is the most detected variant nationally. And so the numbers here in Washoe County we're seeing are now catching up to what we're seeing nationally. The BQ1 and the BQ 1.1 variants are about 42% of the variants sequenced. So those are declining. They were at 54% 2 weeks ago. So we're seeing now the variant shifting with fewer cases of the BQ1 and BQ 1.1 and more of the XBB cases occurring. The good news, though, is that the CDC recently released a report that reaffirmed our recommendation of the importance of people getting the COVID-19 bivalent vaccine. They've excuse me. I'm sorry, had something sticking in my throat. But the CDC issued a report, and they found that the bivalent vaccine appears to provide additional protection against the XBB sublineages compared to the original monovalent vaccine. And so that was the whole reason behind going to the bivalent vaccine, was the belief that that would provide better protection against the variants that came from Omicron. And that's what we're seeing. So encourage people to get that vaccine. Excuse me.
Kevin, I just wanted to say I posted the MMWR from the CDC in the chat if anybody wants to look at some of the data that he was speaking about.
Perfect. Thank you. Thanks for doing that, Scott. So as far as getting the COVID-19 vaccines, we're announcing that at all of our appointments at our community vaccine events, we're not requiring anybody to make an appointment. We're not having that appointment option available. We have plenty of room for people to just show up, and you can get your COVID-19 bivalent booster. Our team will be at the Nevada Urban Indians event this Saturday. That'll be at Galena High School at 10 o'clock in the morning. So an opportunity to get that bivalent booster at Galena High School Saturday at 10. And we're working with the Northern Nevada Food Bank on a mobile harvest drive-through event where we'll have both food from the food bank available and COVID vaccines at the Reno Livestock Event Center. And that'll be on March 7th from 1:30 to 2:30. So come on by to pick up some healthy foods and get a COVID-19 vaccine. Other vaccine opportunities are available. You can go to COVID19washoe.com to see where you have those opportunities. As a reminder, we're providing the COVID vaccine all the days that we're open in our immunization clinic here at the Health District. You know, we've been seeing a lot in the news recently about federal agencies pointing to a lab leak in China being the cause of the COVID-19 pandemic. And the Department of Energy and the FBI have spoken publicly about this. Other agencies believe it was the result of natural transmissions from animals to humans. So there's not consensus on this and not a lot of information available either. The FBI and the Department of Energy have low confidence or moderate confidence in their belief that it came from a lab. So I don't think we may ever really know. But ultimately, I think the most important thing is that we know whether the pandemic comes from a lab or it comes from an animal to human crossover. We need to be prepared for pandemics, and we expect to have pandemics in the future. And a lot of people are looking at the impacts of climate change and expecting that we're going to have more frequent pandemics from that human and animal interface. So what's really important is that we prepare for future pandemics. And unfortunately, I'm not seeing that occurring at the federal government level. We know we need to invest more in public health. And I think what's really important is not to argue about where it may have come from, but to take the steps that we know we need to take based on what we've just been through to bolster public health and be prepared for a pandemic. And I think fortunately here in Nevada, we saw in our state legislature, Senator Doñate and the Senate Health and Human Services Committee pass SB 118 out of the committee the first day that the committee heard it. That's an important bill that would bolster state investment in public health. And I'm hopeful that we'll see that move through the Finance Committee and become law here in Nevada. On the flu front, our influenza-like activity and hospitalizations are remaining pretty flat. We've reported 22 flu-related deaths so far this season, but our flu activity at present remains low. The flu vaccine is doing its job, and recent data on the flu vaccine is really encouraging. It's found that through the season to about January 25th, I believe, was when they had the data on this, that the flu vaccine reduced pediatric hospitalizations by 68% and reduced adult hospitalizations by 43%. And so that's really a phenomenal performance for a flu vaccine. So we've got a real good match occurring this year. And so it's the data also showed that it provided important protection to adults no matter what age. So across the spectrum of age groups, very good protection from the flu shot. And so it's important for people to get the flu shot, particularly those who are immunocompromised. And it's available readily at pharmacies for you to get vaccinated here throughout our community. And we've unfortunately seeing that the cold weather is not going away, it seems like anytime soon. So it's if you haven't gotten your flu vaccine, still a really good idea to get the flu vaccine. And again, if you have not yet gotten your COVID bivalent booster, even more reason to now with the report coming out from the CDC on what they're seeing with the protection that it provides. So with that, I'll wrap up and open it up for any questions, Scott.
Thanks, Kevin. Any questions? Okay.
Got a quiet bunch today.
Yeah. I don't see any questions in the chat. If anybody has one, please speak up. Otherwise, this is being recorded, so we will put this on our COVID-19 washoe.com website. And if you guys want a copy of the raw file, please just send me an email. Otherwise, have a great day. Stay warm. Thank you all for being here. I appreciate it.